most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about cracked and broken ribs. We're going to talk about essential precautions. We're going to show you at-home treatments and recovery time. This is an updated video. We did this before. We're doing it again.
Right. And again, we've got some better information on it. Otherwise, we wouldn't have updated it. Because rib fractures can be very painful.
Yeah, you don't want to mess around with them.
And it's amazing. They can be fatal. And we're going to talk about that potential as well. And then we're going to give you some...
You're going to scare people now.
It's
cautious.
It's a truth.
Precaution.
I've got some statistics. Statistics, exactly.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Pay attention.
Bob, watch
also,
out with Sam.
Go to bobandbrad.com. Go to the giveaway section. We're always giving something away. This week, we're giving away the Booyah Stik.
Oh, yes.
Booyah. Hold on there. I got her. You can also go to Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And if you want to listen to us in the car.
Sure, podcasts we do have. And we have some wonderful speakers.
Or while you're working out. Yeah, great interviews.
So, Bob, are we going to continue?
Yeah, let's continue.
So, rib fractures, we're going to give some statistics. I've got it right that time. 95% of all rib fractures are from blunt trauma, which is not
it could
hard
be a fall. It could be a motor vehicle accident.
Right. As a matter of fact, 53% are from MVA or motor vehicle accidents.
Sure.
Typically falls, it's the elderly when they fall. As you age, things get a little more brittle.
Yes.
And those ribs are more susceptible.
Just happened to my mom.
Yeah.
She's 90 years old and she fell and she broke her rib.
Oh, so how's she doing?
She's doing good now.
Okay.
Good. I'll talk about one of the things I did.
Okay, good. So then we're going to carry on to which ribs are most commonly fractured, and it's the middle ribs, which
makes sense because they're sticking out the most.
Exactly. Keep in mind with the ribs, towards the sternum is a pretty solid bone down the middle, but then there's some cartilage here between the sternum and the ribs. So this area
you
here,
can see different colored here.
Right, exactly. So the cartilage, can rip or tear, but usually it's the bone that
gives way.
It gets fractured. And X-rays, you need X-rays to confirm this. And sometimes you have to have it done by the radiologist because they're small fractures. You don't see them real clearly, but they hurt and they can be painful. And a big thing is if you have fractured ribs up on rib number 1 or number 2, way up here underneath the collarbone, that can be a serious problem because right below that, there's an artery and a vein that come right from the heart. And if they get punctured, that can be life-threatening. So,
like the subclavian arteries up in that area.
Exactly. The other thing is with fatalities, it's typically in the geriatric population, older people, the rib, what happens, it breaks, cracks, and then it punctures into the lung. And that's a pneumothorax.
Or pneumothorax, depending on what is happening.
Right. So the lungs can get punctured and then either blood or some fluid gets into the lungs. You get pneumonia, complications, and that's a real problem.
Or the fact that you can't use one lung, it doesn't help matters either.
Yeah.
So
typically, if you're a younger person, it's not as likely to happen, but you really should go in and get this checked out. If you've got a lot of pain in your ribs, typically with breathing, your rib cage expands as you breathe in. So if you got fractured ribs from that blunt trauma and those rib cage expands, it's like taking and irritating that injury with kind of like a knife because it's very painful. There's also muscles between each of the ribs, intercostal muscles. And when you exhale, they contract so you can breathe better. It's all part of the breathing process, and that irritates it. So you cannot laugh. I mean, you want to minimize your laughing, your coughing.
So don't watch Bob and Brad because...
We're not supposed to make anybody laugh here. All right.
But, it's funny, Brad, on my mom, what I did is I actually put my hands on the ribs and I could find the spot.
Just because it was point tender?
Yeah, and we were just trying to decide whether or not to send her in. I don't want you to use this as a judgment. You should go in.
Yeah.
But I pushed on there, and it really confirmed it. There was a really tender spot.
Sure. Yep. So what we do want to do is give you some things that we talked about: avoiding the laughing, the sneezing, sleeping. This is a little interesting to me. They said try to avoid sleeping on your back, and you can actually sleep if you can do it. You want
On
to get
the side.
right on the side
That's fractured.
where the fracture is. If you sleep the other way, if this is my right side's fractured, I sleep on my left side. That can cause some drainage in there that can, cause a problem with the
Sure,
pneumothorax.
pneumothorax.
Right. One thing for sure is you need to get comfortable.
Sure.
You're going to take pillows as you lie down and place them. So you get your comfortable position. When you fall asleep, you start rolling around. Put pillows alongside of you on each side, or if you're on one side, it helps. Put a pillow on that side under the rib cage there, and that may help you from inadvertently rolling in the middle of the night, and then you wake up with extreme pain and you're saying bad things because of it.
Yeah, you may need some medication here.
Yep,
Definitely. And
exactly.
It's a little bit hard because my mom, we didn't want to put her on any medication that's going to make her sleepy.
Sure.
So no muscle relaxants, no.
Right.
So we're kind of stuck with Tylenol or like ibuprofen
Yep.
or something like
Yeah.
that.
And that you want to consult with your physician with.
Talk to
Depending if you're on
doctor.
other medications particularly,
Right.
you've got to go through the doctor and make
Yeah.
sure things are all working
All
together.
square.
But you can always go, particularly right after this fracture.
Yes.
Things are very tender. Get the cold pack out. Let's get Sam out of the way here. You did a good job for us, Sam, but we don't need you. You should get a cold pack that's soft and pliable when you pull it out of the freezer. I've had patients, they'll take the cold packs that are in from your cooler, and they're
they're
plastic hard, and
Yeah.
they put it on and it's not very comfortable and it doesn't conform. So you want to, can you just move
Brad,
on, Bob?
actually, if you look up Bob and Brad how to make a ice pack,
Yep.
Brad goes over on how to make one of these
Yep.
just for using rubbing alcohol and
Water.
water.
Yep. And Ziploc freezer
Yeah.
bags. Yeah.
It makes
Yep.
a great bag.
They'd work really well, actually. But just like this, I have one at my house, my freezer right now. My
Sure.
mother, I made one for her. It's cheap. They work wonderful. And anyways, there we go. We can put that on here. Getting out of bed can be a real challenge.
Sure.
You're going to have to work on log rolling and not twisting and getting up,
Pushing
using
up
your
with your
arms,
arm.
taking your time. And you'll know it's not going to be fun.
So later on, what I did with my mom, because this was lasting a couple days
Yeah.
to a week, and I wanted to get her the best help she could get.
Sure.
So I bought her a Thermotex. These are pricey, but these provide deep heat. Normal heat only goes like skin deep,
Right.
but this goes 2.36 inches.
Exactly.
2.36 inches. So I knew it would get in there into the rib area,
Right,
the muscles around
right.
it, and she liked it. I mean, so
Sure.
I moved up on the list on our family. I come from 11 kids,
So start out with a cold pack,
Yeah.
but after the inflammation settled down and it's starting to feel better in a few days, transition, maybe even a week,
some type of heat.
to some type of heat.
Yeah.
The other thing is wrapping the ribs with that ACE bandage and keeping it all
You're not
closed up.
supposed to do that, right?
No
wrapping.
Absolutely no wrapping. It constricts things and it can cause problems. So
Yeah.
that's one less thing off the list. That's a
Right.
good deal, I'm thinking.
Yeah.
So no wrapping. Once your ribs start to feel better, coughing, breathing is getting better, then think about deep breathing, 5
Yeah.
to 10 deep breath. So using the rib cage, good posture, let the shoulders go back and let that rib cage expand. And you'll know, well, you'll get so big and then all of a sudden it's going to start to hurt. And when you hit the sharp pain, don't push it, exhale. So you go in maybe 50%, ow, then exhale, and do that 5 to 10 times, and do that every couple hours throughout the day, because you don't want that scar tissue where
Right.
the broken ribs are to scar down and get tight, because it's going to cause problems down the road.
You could even lie on your back and bring your arms up overhead
There you go.
and take some deep breaths that way too.
Yep.
That'll really expand that rib.
Exactly. Should we here, Bob? Let's just show that, because I want to
Sure.
bring this into something else. So you're doing your breathing, and then your 10 breaths feel pretty good like this, and then start to do this, and you may find you only get to hear, especially on the broken side, ooh, because bringing it up is going to hurt. But after a few days, deep breath with this, and once you can do this, 5 or 10 repetitions, and it's not so sharp pain, it's just feeling some stretch, then we're going to progress on to rotation.
Sure. Where you can use the Booyah
Yeah,
Stik on that.
and this is where you really need, you can use a cane. I've done this with patients.
A
little bit,
broomstick you could use.
use a broomstick. Something has to be strong because you're going to put it over the back of your shoulders and like this. And the reason we use this, and you do it in a seated position, not standing, is because seated locks your pelvis in.
Yep.
Putting your hands here, lock your shoulders in, and then we're going to rotate. So all the rotation happens in the thoracic area or the ribs. So you're going to go both directions. Now, if one way is probably going to hurt more, when you get to the sharp pain, you stop. Don't push it. If the other way feels better, go until, you know, how pain tolerates and allows you. And again, you might just go one way because this way really hurts. You know, and the next day you'll find that you do 10 to the left and back to the right. You can do 5, and it's not as far, but it's better.
Sure.
So progress as tolerated.
So you can see if I did that standing, my pelvis might move.
Yep. I mean, you can do it, but it's going to be more
right.
effective in a seated position.
Exactly.
Bob, the next one I want to talk about is you're going to use a stick again in a seated position. You're not on a rolling stool, but you know, as long as you're in a chair, and let's say it's on my right side, we're just going to stretch this. And I call this the Statue of Liberty stretch. Arms up like that.
There we go.
Bring that arm up till you feel a stretch. Lock the hand on that stick and just lean forward, and you're going to feel that rib cage stretch. Again, 10 repetitions, not into the sharp pain, into the stretch, and do that a few times a day. And that will improve until you get to the top, and you can really stretch it out.
Yep, you're stretching all the muscles that attach into the rib cage too when you do that. So
Right.
it really works out
Yep,
well.
exactly. For these younger people, then you want to do that for sure.
Sure.
You could if you have a pull-up bar, you could. Okay, if you have a pull-up bar, that you can just use body weight to hang and stretch that rib cage out. We have our pull-up system here that works well. Back to the wall actually kind of can help work on your posture. Use whatever you have to hang on, and gently, don't just, if you have to jump, give it a quick stretch, that won't work.
Right.
You want to get up on a stool and let your body weight go down gently. Same rules. No sharp pain, just a stretch. And you can go on and off with that. Or if you can hang and it's starting to feel good, you know, you may hang for 20 to 30 seconds and get a good stretch.
Taking
You can
most of the weight
yeah,
now on
you can move around, you know, when you get better. This is for the younger people who are going to get active. They're going to get into a sport. You may do this as well, 5 or 10 repetitions, and really get things mobilized.
Moving,
yep. Sit-ups. Get into your sit-ups because you want to work on contracting those muscles. However you want to do
Not
sit-ups.
full sit-ups, so
No.
curls.
Yeah, curls. I'll show if you.
Sure.
So, you know, just this. You know, we're doing this. You know, we're not, and you want to make sure
Bringing
you
the head
get some,
straight up almost.
some diagonals as well.
Sure.
Not this.
But keeping the back flat against the bed or the floor.
Exactly. Very good. Oh, I do want to talk about this too. Is I think it's really helpful.
Right. This is a good one, I think.
If you got a band with handles, they work wonderful. You're going to connect it to a door, to a wall. We use the wall anchor. It works well. And this really works that core. And we call it stir the pot. You're going to get in that athletic position and you make circles. Tighten everything up. And you'll probably find one way, yeah, not so bad. Then you go the other way. Oh, that's waking you up a little bit. So you're going to work yourself into it. So you can do that for 30 seconds at a good resistance. If you need more resistance, simply step away from the
What's
wall.
funny about that, every time I watch that or if I do it, it doesn't look like you're working that hard.
No.
But you are.
Yeah.
I mean, it's you feel it and you're working the muscles.
Yep,
I mean,
exactly. Yeah, it's a great way to trunk or strengthen that core.
All right, good job, Brad. I'm going to give you some
Really?
kudos. Yeah.
Oh, wow.
You did
Okay,
well.
then. Say no more.
All right. Thanks for watching.